Hey everyone, hope you're doing well, staying safe, staying healthy, staying in your house unless you have to go out and go to work. Um, I myself feeling better. For those of you that have been following my saga a little bit, but so feeling better here. Fever's gone, cough is minor. I can breathe through my nose again. So if we had it, we had it. If and we survived. If we didn't have it, then I guess we'll stay in the house so we don't have to worry about getting it. For those of you that are out there working, be it in healthcare or working in a service industry or something like that, thank you. We appreciate it. Everyone from the physicians and the respiratory therapists that are helping people on ventilators, saving lives in hospitals, to the nice man from Uber Eats that brought my dinner last night. I appreciate everyone that's willing to, be out there and be working in such a crisis. It's really is. I've been around a while, and in my almost 50 years, this is just insanity. I lived through the Ebola stuff and the when AIDS was first discovered, and all of the things that these major pandemic type things. This is certainly on a level that is unlike anything we've seen. Or at least unlike what most of us have seen, unless you happen to be around in 1918, I suppose. So just take care of yourself. Be careful. Yeah, I know that, like even yesterday, we went out for a walk because we've been trying to at least do that each day. Tons of people out, but not just walking and keeping themselves, but tons of people in groups. Even if you're they're your friends, whatnot. Just stay away. Stay back. Try and we still don't know a lot about this, and I wouldn't want to see anything bad happen to any of you guys. So it's hard to not want to gather and commiserate with your friends and family, but if you can, obviously, I have a house with my son and my husband. My son came here after he finished his hockey season, so at least I've got him in the house, and obviously my husband. But we've been staying away from others just because it's well, especially us. We quarantined ourselves for 2 weeks because we both were pretty sure that we were sick. But yeah, so just do your part. I think that's all we can do at this point, is do the best we can do and try and stay positive, and go from there. So if you are out there working, like I said, thank you so much. It's scary out there right now. So it's thank you for doing that. In talking about working, whatnot, human resources. Obviously, this is really a challenging time for human resource officers everywhere, not just in healthcare. Especially in healthcare, though, because you're asking employees. Everyone that's walking into that facility is putting their life at risk right now. So it's really my hope is that, and I haven't had contact with folks out there, but my hope is that the majority of non-essential employees have been sent home to work. There's no reason for the finance staff or the billing staff or the coding staff, medical records, quality. There's no reason for them to be in the facility right now. I'm hoping that they've allowed them to go home and work, but there's such a stigma in healthcare about working at home. There's some notion that you're not as productive, which I would highly disagree with. I'm much more productive at home, but I can understand there will be people that aren't necessarily independently motivated, and they need someone. They need their boss or their coworkers or someone to motivate them. So I can understand it, but so hopefully, if you work in one of those roles, that you are at least allowed to work from home, like we are. It's pretty easy for us to work from home in higher ed, especially when we're teaching online classes to begin with. But in any case, it is challenging. You're dealing with union issues and dealing with all kinds of different things that are problematic for your employees. Because they are in situations that we haven't dealt with before. So just interesting time right now for human resources folks. Last week we talked about the interviewing process and the role of the department manager and HR in interviewing. important stuff there. I look forward to seeing your infographics. I think that it's interesting. I've done a lot of interviews in my day. My husband just had the opportunity to do some interviewing a few weeks back, and some of the questions that they asked him, and I just shook my head because you can't ask those things. But they had specifically asked about his children and how old they were, and all of these things that it's just inappropriate to. And he hadn't offered. If someone offers information, you can't. That is what it is. But there was no reason to have that discussion. So interesting nonetheless, and really important that department managers know what is legal and what is not. So I look forward to seeing what your thoughts were on those. So this week we are digging into training and continuing education. So organizational development is a large part of any healthcare organization. You have tons of mandatory trainings that your clinical staff will be needing to do. You'll have some mandatory trainings that all staff will need to do, like compliance, right to know, workplace safety, those types of things. And a lot of those things are mandated, and you'll read a little bit this week about how some of that is just useless because they just keep hearing the same things over and over, and lots of other reasons why that training isn't helpful. But professional development, ongoing, continuing ed is so important in any setting, but especially in healthcare. And especially when we're looking to educate, we have to provide clinical continuing development because they need that for licensure. There are also other folks that are certified, like coders and medical records technicians and whatnot, that need that. CPAs, anyone that has a certification typically needs CEUs, continuing education units, to keep that certification. But then we also want to provide professional development opportunities to all of our staff. So maybe you have a frontline unit secretary that's looking to move up, that wants to move to a different role or a different place. How can we facilitate that? What education can we provide her so that she can move up? So lots of info about education and training this week. We have an assignment about what are some things that you could do as a department, assuming you're a department manager, what can you do that would be reasonable in price or cheap or free, but can also engage your employees and provide them with some additional education. And we have our discussion this week about different training and development opportunities as well. And we have our quiz. So let's hop over to the quiz questions from last week real quick. So first question, why does the frequently occurring delay between the time an offer of employment is accepted and the individual starts work exist? Well, the main reason for that is you'll make an offer to somebody, but that offer is conditional on a reference check, and especially in the healthcare setting, typically a physical exam and immunization check or titers, whatever you need to have done. You might have to draw titers if you don't have a solid immunization history. So that time is needed to go through that process. I think the question or the answer that others chose more frequently was a certain delay is allowed in case the incoming employee has to work out a period of notice. And that's true that people usually do have a notice period, but that's not really why that delay really exists. Because, like, for example, right now, if I were to get another job and leave RMU, my notice period would be from now until the end of May or middle of May, because I wouldn't be able to leave here until I finish this semester. Whereas, someone that works at a grocery store can probably give 2 weeks notice, or some people choose not to give notice, which I think is rude. But you usually would give 2 weeks notice so that they can be able to try and find someone to fill your role in that time period. But let's say you're going from that store to you got a job in the hospital. That time period between when you accept the offer and when you go there isn't based on that 2-week time frame. You may be able to accomplish everything in a week, which would allow you to start a week later, accomplish reference check, pre-employment physical, etc. Oftentimes the delay that you have going from one job to another that you impose is probably longer than what is imposed by human resources. They just need that time frame to be able to check references and get you in for those pre-employment checks, physical exam, etc. The delay that you may personally impose is going to vary greatly. It could be, yeah, I can start tomorrow, or no, I can't start for 2 months. So that's not what causes the delay. It's really that reference check and physical. Next question. What is true of recruitment for an especially desirable position from outside of the organization compared with the recruitment or by transfer or promotion from within the organization? So sometimes our answer is sometimes the only available means of locating an individual having the appropriate qualifications. So obviously we want to try and promote from within when we can, but and a lot of organizations really do take an approach. I think back to the place that my husband worked, the hospital he worked at back in New York. There's a gentleman who was the chief operating officer of the home care division. He started out as a dishwasher there and literally worked his way up and is now an executive. So there are some places that really take that tact. The problem with that tact is sometimes you're putting people in roles that they are not qualified for. So, for example, let's say I work at RMU. I'm a faculty member, and the provost position becomes available. It's not likely that I'm going to be able to move into that provost position, but in some places they will move someone into a role that they're not necessarily qualified for. I'm certainly not qualified to be a provost. Not yet, maybe someday, but not quite yet. So you really RMU is a great organization for moving people into roles from a previous role. But the good thing that we've had is that the people that are moving into those roles are qualified. Like, for example, the interim dean of our school right now, Dr. Semich, he's not from nursing or healthcare, but has broad knowledge of higher ed operations and administration, and has been a great asset to our organization, to our division for nuke med, health service administration, and nursing, because he is knowledgeable overall of the types of things that we need him to be. Whereas had they put someone, one of the RMU police officers in that role because they wanted to promote him, that would have been inappropriate. So sometimes the only way to get someone with the right qualifications is to recruit from outside. And sometimes you just have to do that. For example, we'll use the dean position. Obviously, Dr. Semich has been fulfilling that role, but at the end of this term, he is stepping down and going back to his previous role. So although he could very well have had the position likely if he had wanted it, but they are going to the outside to find somebody because the people from within didn't have the right qualifications or didn't want the position. So sometimes it's important to go outside. The other reason that it's important to go outside, and it doesn't really relate to this question directly, but sometimes bringing someone in from outside can give you a new view. You have a whole different look at things. And I'll use my experience as an example. So when I came to RMU, I had a very different view of the healthcare system and healthcare in general than folks that have only been in Pittsburgh. Pittsburgh has a very interesting healthcare system with the two organizations, AHN, UPMC, and it's not really a lot like anywhere else in the country. So things that happen, like there's a very I'll use the word nepotism because it's the only one I can think of, but there's a very nepotistic nature to hiring in healthcare here in Pittsburgh. It's very difficult to get a job at a higher level unless you know somebody in that organization. Places don't necessarily look for people outside, or if they're looking for someone outside, they want someone they know. And that's not the norm across the country. Most places you can at least get an interview if you have interesting background and qualifications. So when I came to RMU and kind of talked about the way it is everywhere else, or at least everywhere that I've had the experience with, it was seen as a different view. It doesn't mean that networking is not important. Networking is important regardless of where you are in the country, but it is vitally important in the Pittsburgh region because you need to make friends and meet people throughout if you want to move up through the healthcare organizations. Whereas outside, it's great to have that, and sometimes you can call on that, but you can certainly get a job in a hospital without knowing someone there. So sometimes people bring a different view than exists in that organization to start with. So another thing that's really important about recruiting from the outside. What is true of salary bumping? So salary bumping is really about when you have a job that's typically very technical, specific, requires very specific qualifications, and you'll find like if salary is bumped in one area, it ends up being spread across. It's it doesn't do, and our correct answer is when it's successful, it raises the cost of doing business without increasing the local supply of talent. It's usually about organizations having to match salaries and for those technical positions without necessarily building providing opportunity for new people because they are very technical. So let's just say. Maybe inpatient medical coders, for example. If inpatient medical coders get word that they're getting paid a lot less here than they are elsewhere, which they are, but then it may be an instance where they start to look at other places. And we're actually dwindling the talent pool here. So the organization may look to bump their salary. Other organizations are going to end up having to do the same, or they're going to start losing people. But it's not creating any new coders. It's just creating more cost for the organization. So it's something that sometimes we have to do, but it's certainly not a positive, except for the person that's getting this bump in salary. It's from an HR perspective, it's not a positive. And it really does just raise the cost of doing business without providing any more local talent, unless you pilfer someone from another organization to fill that, and then there's nobody to fill that role at that other place. So it's not a positive. It's certainly a negative overall. So that's all I've got. Let's go back to the classroom quick. So, like I said, we have our discussion, our assignment, our quiz, this ed puzzle, and then some reading for this week. But if you have any questions, as always, feel free to reach out. I'm here. I'm stuck here, so I don't have a choice. But feel free to reach out, drop me an email. I'm happy to meet up with you in the classroom, virtually, if you need assistance on anything. And otherwise, stay safe and healthy, and I'll talk to everyone in the classroom. Thanks.